Hey guys, Dr. Norris here, owner of Koru Chiropractic, Corrective Care and Wellness. And today I want to talk to you a little bit about car accidents and insurance and chiropractic care. Unfortunately, a lot of people first meet a chiropractor after they've had a serious injury or accident, most commonly being a motor vehicle accident. And the reality is you're moving in a big, heavy object that's going to collide, and it's going to move your body in a way that you would have a hard time getting it to move like that, even falling off a bike or doing other adventurous activities in sports. But that can happen too, and a lot of those smaller injuries result in some similar issues, mainly whiplashes to different parts of our spine, most commonly the neck, but it can happen in our low back as well. And so today I want to talk to you a little bit about why we take insurance for auto accident, and also how do we help people who have been through an auto accident, whether it's a problem in their neck or their low back or somewhere else. So a direct pay practice, meaning most people who come in off the street, they're paying us with cash or credit or an HSA account, and then potentially trying to get reimbursed through their health insurance. But when you have an auto accident, even if you have health insurance, the rule is that you're supposed to be using your auto accidents coverage first. And in Colorado, a lot of us have MedPay, right? So MedPay is an additional insurance that you can add to your auto insurance. It costs dollars a month. It's really cheap compared to your auto insurance itself. And so most people opt into adding that on, and I encourage you to do that as well, because you just don't know when an accident's going to happen. And it's one thing to lose your car, it's another thing to lose your car and maybe potentially injure your body, and hopefully it's to a point of repair. But if you can't take care of yourself, if you can't get the medical treatments that you need, then it's going to be really hard to get a full recovery, right? The reason we take auto insurance is because, one, people are usually pretty down and out when they get hit by a car, and we want to just make it easy, get them care right away, not have them have to worry about their budget or saving up money. And the other reason is because auto insurance pays us pretty much exactly the same as what we charge cash. So for me, it's a quick reimbursement, it's simple, and I don't have to play games. And that's the reason we don't take health insurance, is because nowadays there's a lot of game playing in the managed healthcare world, right? And so it's easier for me just to have a flat fee. Most people can afford it, and we're able to help most people who come in off the street who are looking for quality chiropractic care. Now, when people come in with auto insurance, again, like I said, sometimes we're using MedPay, sometimes it's already gone to the point where they know they're going to go to a settlement, and we work with a couple companies to hold liens and be able to take care of people when they have big bills, and they don't have to worry about paying us directly, and we don't have to wait a long time to get paid, potentially years, for it to go through the court system and get a settlement or have a trial. Okay, so again, if you have MedPay, that's something that we can help you with. If you don't, let's talk. Maybe there's something we can do or direct you in the right direction. Now, let's get to the reason why people need chiropractic care after a car accident. Well, you got this big noggin up here, and this is the back of your head cut off, right? And so looks something like this. And when you get into a car accident, and actually sometimes it's worse at low speeds, people go, oh, I just had a fender bender, I didn't total my car. Well, totaling your car is actually when the engineering of the car works the best, because it kind of crumples around you, and the parts of the car really take the blow. Your body definitely does as well. But when you're at low speeds, the car doesn't break the way that it's designed to in a high speed crash. And so a lot of those forces are just shook right through the car. And that's when people will get a whiplash injury. And again, here's your face would be up here. This is the back of your head, and this is the top half of the neck. And what happens is you get this shear force where things really go back and forth and whip. And what we can't appreciate is the discs that are in the spine, right? And so you have this disc here, and when it goes forward like that, it really creates a tearing effect on the disc. And so for some people, typically they have a problem, maybe a little bit of arthritis or degeneration going on, and then they have a really high speed accident, and all of a sudden, boom, disc is torn, you got a herniation or a bulge of the disc, and it's putting pressure on the nerves, and it's causing some pretty extreme pain. And usually that's a 8 or 9 out of 10 or worse. And the thing is, when the disc tears, you can see it wants to start bulging out here, right? And when that bulging fragment gets onto that nerve right there, it's tough. It's a tough life to live. And we're really fortunate that we know how to get people feeling better who have that problem. In fact, just this past week, we've had 3 people come in with herniated discs, walking completely crooked because the pain hurts so bad. And if you've ever had that, how you end up walking when you're in a lot of pain. And within a couple visits, they're standing up straight again, and their pain is down into the low, under 5, kind of 4, 5, maybe 6, right? And then it just gets better with time. But with corrective care, what we're really focusing on is restoring the curves of the spine that often is lost with a whiplash injury. We're also doing specialized adjustments that help us work around really tender areas, really areas that are really sensitive, And we use things like x-rays to really pinpoint where do you need the adjustment and which way do we need to move the bone. So there's no guesswork, and we're not having to rough you up just to figure out what's working. It's really a much more poignant approach. We're able to really, be snipers on the target versus shotgunning everything and hoping it works. A lot of people are surprised, they had a whiplash injury, maybe they have a pull in their low back, a lot of pain, and then we find out when we do the exam, actually the problem is really in your neck, but it's causing pain down low, right? And other times it's a combination of the two, right? The case I had today, the gentleman's coming in and he's got some problems in the top of his neck that is affecting how he stands and altering his pelvis, but he also has a legitimate ruptured disc in his low back and rotation of his pelvis in the wrong direction. So we're adjusting him both top and bottom, and that's what's helping him get straight and even and feel better really from one visit to the next, and in a very quick and efficient manner. We're very different than the average place that people end up after a car accident. A lot of people end up kind of at these auto injury mills that have a lot of things that they do that can be billed towards insurance, and essentially they're making a lot of money on you, but the results are questionable, right? And this is all too common, and again, part of the system per se, but being kind of outside the box allows us to have a little more freedom. We can still use our specialized approach for people who are looking for that and get them an amazing result. So, we also are recommending corrective exercise, which allows us to strengthen and stabilize the spine after an accident. And we even do things like traction at times to allow the discs to decompress and get someone's curvature back into the spine. So if you've had a car accident, if you're really suffering, a lot of people who come see me, maybe even tried other chiropractic, tried physical therapy, and they're not really figuring out where to get the results. Things are inconsistent at best. And that's something that we really specialize and pride ourselves in, is that we can figure out where the root cause of the problem is, aim on fixing it, and ultimately people end up coming in less often, getting a better result over the same period of time. So if you have had an auto accident, if you've had a whiplash injury in your past even, and it's a lingering kind of problem and it hasn't been completely resolved, you may not be able to use insurance depending on your timeline with that, but people who have suffered from motor vehicle accident injuries are people that we can help and really get their lives back on track and get them back to living their best life. So if that's you and you feel like you could be living a better life and that your body and your spine are holding you back, we would really love to consult with you and talk to you about what's going on, how we can help you, and then hopefully get to work. All right, guys, have a great day. Hope you're being safe. Hope you're not getting into accidents and injuries, but if you are, we're here for you.